You have been managing the obvious stuff. The tiredness, the brain fog, the weight you cannot shift. You know those are connected to stress. But there are 5 symptoms happening in your body right now that you would never connect to cortisol. And that gap between what you are experiencing and the actual cause is exactly what I help close. Because most people are told what they are experiencing. Very few people are told why. And the 5 I am about to show you are almost never in the conversation, especially the last one. So the question is, can high cortisol cause symptoms that have nothing to do with stress, anxiety, or weight? Yes, and here is why this matters. Cortisol does not stay in the stress lane. It is a steroid hormone with receptors in virtually every organ system in your body, including your gut, your bones, your eyes, your immune cells, and your pain pathways. When it is chronically elevated, it disrupts biological processes you would never associate with a stress hormone. Here are 5 symptoms you need to be aware of. Symptom 1. Digestive problems that appear without any dietary change. Your enteric nervous system, the 500 million neurons lining your gut, is directly regulated by cortisol. Under chronic elevation, cortisol increases intestinal permeability by disrupting the tight junction proteins between gut epithelial cells. The result is what researchers call leaky gut syndrome, bacterial fragments and undigested food particles entering the bloodstream, triggering systemic inflammation. Think of your gut lining as a carefully maintained brick wall. Chronic cortisol is the slow flood that dissolves the mortar between the bricks. Nothing dramatic. Just a gradual erosion until things start getting through that should not. You feel bloating, IBS-like symptoms, food sensitivities that appeared from nowhere. These are cortisol symptoms, but nobody is joining those dots. Symptom 2. Increased sensitivity to pain, especially back pain and joint pain. Cortisol in short bursts is anti-inflammatory, but chronic cortisol has the opposite effect. It paradoxically increases neurological pain sensitivity by upregulating substance P, a neuropeptide that amplifies pain signaling in the spinal cord. Simultaneously, chronic cortisol suppresses the body's natural endorphin production, removing the internal pain buffering system that should be dampening those signals. As a result, your pain threshold physically lowers, and the aches that you dismiss as aging or posture are frequently cortisol-amplified pain signals running through a nervous system that has lost its natural buffering capacity. Symptom 3. Sound sensitivity. Noises that never bothered you now feel overwhelming. Your amygdala, the threat detection structure in your brain, increases in functional reactivity under sustained cortisol exposure. Neutral auditory stimuli that previously registered as background noise are reclassified as potential threats. Your startle response becomes hair-trigger sensitive. This is measurable neurologically. Research shows that chronic glucocorticoid exposure increases amygdala dendritic branching by approximately 20%, growing more neural connections dedicated to threat processing. Your brain is not being dramatic. It is being structurally reorganized by cortisol. Symptom 4. Increased urination, especially at night. Cortisol directly suppresses antidiuretic hormone, ADH, which is the hormone that tells your kidneys to concentrate urine and reduce water loss overnight. When cortisol is chronically elevated, ADH suppression disrupts the normal overnight fluid regulation cycle. The result is increased urine production during hours when it should be minimal, waking you at 2 a.m. or 3 a.m. for the bathroom, which then makes returning to sleep more difficult, which elevates cortisol further. The cortisol-ADH sleep disruption loop is one of the most underreported mechanisms in the insomnia literature, and almost nobody connects getting up to urinate at 3 a.m. with the same root cause as their daytime anxiety. Symptom 5, and this one genuinely surprises everyone who hears it. Bone density loss. Cortisol directly inhibits osteoblast activity, the cells responsible for laying down new bone tissue, while simultaneously activating osteoclasts, which break bone down. In the short term, this is not detectable, but after 12 or more months of chronic cortisol elevation, dual-energy X-ray absorptiometry, the DEXA scan used to measure bone density, shows measurable reduction, particularly in the lumbar spine and femoral neck. Research published in the Journal of Bone and Mineral Research shows that individuals with cortisol levels consistently in the upper quartile of normal range show bone density values comparable to those 1 decade older. Chronologically, you are not just aging. You are running a hormonal program that is accelerating the structural deterioration of your skeleton, and nobody is connecting that DEXA scan result to what is happening in your adrenal glands. So what does this really mean? 5 systems, 5 symptoms. One source. Your gut permeability, your pain threshold, your sound sensitivity, your overnight urination, and your bone density, all downstream of chronically elevated cortisol, all presenting as separate problems, all traceable to the same HPA axis dysregulation. Which of the 5 surprised you most? Drop the number in the comments. And if you have been treating one of these as a completely separate health problem for years without connecting it to stress, I want to hear which one. Because the number of people managing gut issues, joint pain, or sleep disruption without anyone ever suggesting their cortisol might be the root cause is exactly why this channel exists. I have put together a free cortisol system reset guide that maps specific physiological interventions to each of these downstream effects. Not symptom management. Root cause inputs that change what your adrenal glands are producing. The link is in the description. Subscribe now because the next video covers the 15 symptoms of high cortisol that even most doctors miss in a clinical setting, including 3 that overlap with autoimmune conditions and are routinely misdiagnosed. And the mechanism behind why cortisol mimics those conditions is